Hi, my name is Nigel Rossiter. I'm the chair of the Primary Trauma Care Foundation, and I sit with another 64 organisations on the G4 Alliance, and we advocate for surgical obstetric trauma and anaesthetic care. And the Primary Trauma Care Foundation is one of only two organisations in that alliance that actually are the voice of global trauma. And why is global trauma an issue? Well, it's a real issue because it is the biggest killer of the age group between 5 and 29. And that's a problem because the majority of the world's population live in low and middle income countries, and the majority of the working population in those countries are between 5 and 29. So the biggest killer of people in the working population in those countries is trauma. And yet, trauma gets less than 1% of global healthcare funding. We're living through a pandemic, and contagious disease, which COVID-19 is part of, get over 60% of global healthcare funding. Now, there's nothing wrong with spending a lot of money on contagious disease, but we need to get the proportions right and be able to invest in healthcare that affects the working populations of countries. By investing in that healthcare, we can increase the GDP of those countries and make those countries much, much more effective in the future. So investment in trauma really reaps dividends for those countries and the population in the future. And I hope from 2022 onwards, we're going to see much more of that.